Okay, moving on to bispecifics, very similar structure when we're talking about the antibody. But the idea here that instead of having the antibody directed to one antigen, bispecifics can attach, or sorry, can attack two targets at the same time. So if you look at number A, you look at the Fab regions, the two arms, they are the same colors, meaning that that antibody binds to one target. And then if you look at C, at the figure here on top that is marked C, that the two Fab regions are in different colors, which means that they can bind to two targets at the same time. And I don't want to get too technical, but also the FC portion, we can also play on it and try to make it even more immunogenic to activate the immune system. So bispecific antibodies, nothing is attached to them. It's just an antibody that binds to more than one target. The analogy that I always use is basically like the fork that we use to basically eat steak, right? You put the steak on one side and then the potato, and this is where you hit the right spot. For my vegetarian friends, you can think about maybe like falafel and hummus or something like that, trying to hit the right spot by attacking more than one antigen at the same time. So how do bispecifics work? Very similar principle to ADCs, but there is something here that I want to discuss. Let's start with the obligate bispecific antibody. So you have that antibody that binds to two targets, but in order for it to work, you have to bind both targets at the same time. So it's obligate bispecific antibodies. And then you have combinatorial bispecific antibodies where you have two targets, right? But if you attach them or if you bind to them at the same time, that's great. But it will also work if it binds to each target independently. And that's, similar to amivantamab that we're going to talk about in a second. So let's talk more specifically about the types of bispecific antibodies, from a mechanism of action standpoint. So we have bispecific antibodies targeting dual immune checkpoints. So we don't have anything that is approved right now, but there are a lot of these bispecific antibodies that are in development. So one arm will bind to our PD-1 or PD-L1, similar to. So basically, let me give you an example. Think about this as ipi and nivo, or ipilimumab and nivolumab in one antibody. Ipi is an immunotherapy that targets CTLA4. Nivo is an immunotherapy that targets PD-1. So put them in one antibody. Instead of having two drugs, you just put them in one drug. So that leads to more immune cell activation and then hopefully more immune effects on the cancer cell. We have some bispecific antibodies that target immune checkpoints such as PD-1 and then angiogenesis. Angiogenesis are the proteins that are important in the development of the baby blood vessels to and nourish the cancer. And an example on this is ivonescimab. So it's a drug that has a lot of buzz. We're all hoping that it would deliver on the promise. The results look very, very promising. So one arm binds to PD-1, the other arm binds to VEGF. The idea behind that is binding both at the same time will lead to higher immune response, and then you attack the cancer in two different ways. And then we have the bispecific antibodies that target signal pathway blockade. This is your amivantamab, which is approved in EGFR positive non-small cell lung cancer. You have basically one antibody binding EGFR, the other binding MET, and you just put them in one antibody, creating amivantamab. So you can bind the MET and the EGFR at the same time, but even if you bind each of them independently, the drug will still work because these two pathways these two proteins are very important to the EGFR positive non-small cell lung cancer. And then we have our BiTEs, or bispecific T-cell engager. Balaj Helmus, or Dr. Helmus, always uses the analogy of the matchmaker. So you have your antibody or tarlatamab. It tries to bring the CD3 positive T-cell, so the immune cell, closer to the cancer cell. And if the spark happens, right, this is the response. Sometimes it can be overwhelming, causing side effects, but it's basically the matchmaker for small cell lung cancer. You can target your T-cells, but you can also target other types of immune cells, such as NK cell and some other types of T-cell.